Defining violence and rape. As we begin this next section, I want to remind us of something simple but profound. The way we define violence shapes the way we respond to it. If we define it too narrowly, we risk ignoring the many ways people suffer. If we define it too broadly, we risk losing focus on the serious, systemic harm it causes. So what exactly is rape? From a legal perspective, rape is typically defined as non-consensual sexual activity carried out through force, threat, or incapacitation. That's the language of law. But as many of you know, lived experience often stretches far beyond legal categories. For example, research by Muehlenhard and colleagues in 1992 asked people to describe what they considered to be rape. Yes, many respondents mentioned force and penetration, but others included acts like coercion, manipulation, drug-facilitated sex, or unwanted touching. This tells us something vital. People intuitively recognize that rape is not only about physical force, it's about the violation of autonomy and consent. Now, why does this matter? Because many survivors do not even label their experiences as rape if they do not fit the narrowest legal definitions. Peterson and Muehlenhard, in a 2004 study, identified what we now call unacknowledged rape. This is when a survivor experiences an act that legally qualifies as rape, but they themselves do not call it that. Think about the implications. If someone doesn't label their experience as rape, they are far less likely to seek medical help, to pursue justice, or even to reach out for support. They may internalize the harm, treating it as something they should simply endure. And often this is fueled by rape myths, those false cultural narratives that suggest real rape only happens if there's a stranger in a dark alley, if the victim fights back, or if visible injuries are present. When those myths dominate, countless survivors are left unseen and unsupported. The consequences are staggering. Survivors who do not acknowledge their experience as rape are often isolated. They cope privately, carrying their pain alone. In contrast, survivors who do recognize and name their experiences as rape are more likely to seek help, engage support networks, and pursue a sense of justice. That recognition itself becomes a step in the healing process. Let's pause here for a moment. When we talk about rape, we often focus on legal systems, statistics, and policies. But I want us to think more personally. Imagine a student, a congregant, or even a friend confides in you and says, "Something happened to me, but I don't know if it was rape." How you respond in that moment matters. If you hold tightly to legalistic definitions, you may unintentionally silence them. But if you listen, if you validate their sense of violation, you open the door for them to process, to name, and to heal. Psychologically, the impact of rape is profound. Resick, in 1993, documented the course of what she called rape trauma syndrome. Immediately after an assault, survivors may experience fear, anxiety, depression, low self-esteem, and even physical symptoms like muscle tension or stomach pain. Over time, these can give way to nightmares, avoidance behaviors, phobic reactions, and in many cases, post-traumatic stress disorder. Some survivors recover over months, but for others, these struggles can last for years, or even become chronic. Importantly, the severity of these symptoms doesn't depend only on the assault itself. Factors such as the survivor's prior mental health, the nature of the relationship to the perpetrator, and the quality of social support afterward all shape the trajectory of recovery. And here again, we see the impact of social reactions. When survivors are met with disbelief, blame, or minimization, their distress deepens. When they are believed, supported, and validated, healing is possible. Let's also distinguish sexual violence from other forms of violence. All violence causes harm, but sexual violence is unique in that it strikes at a person's very sense of self and gender identity. It reinforces systemic hierarchies, men over women, dominant over vulnerable, and it leaves psychological wounds that can feel inseparable from identity. As Schnitker argued in 2022, sexual violence is not just an act of aggression. It is an act that reshapes how people see themselves in their bodies, in their relationships, and in their communities. And here's another critical point. Our discussions must not fall into the trap of assuming only male perpetrators and female victims. While that pattern is statistically the most common, the reality is broader. Men can be victims. Women can be perpetrators. Sexual violence also occurs in same-sex relationships, where stigma and silence can make disclosure even more difficult. Research by Turchik and colleagues in 2016 warns us not to exclude these realities, because doing so only reinforces silence and isolation. Finally, we must recognize the scale of underreporting. Mary Koss's landmark 1985 study revealed that most survivors do not identify themselves as rape victims, even when their experiences clearly fit the definition. Her study introduced terms like date rape and acquaintance rape, exposing the reality that most sexual assaults are committed not by strangers in the dark, but by people known to the victim. That finding remains true today. Acquaintances, friends, partners, even family members are often the perpetrators. So, as we conclude this section, let me summarize with this. Definitions matter. Narrow legal ones can exclude real experiences of harm. Recognition matters. Survivors who acknowledge their experience as rape are better able to seek support and begin healing. Language matters. Our words either reinforce harmful myths or help dismantle them. And finally, listening matters. As future leaders, scholars, or practitioners, the way you listen to survivors can either shut them down or empower them to heal. With that foundation in place, our next step is to examine how religion and social norms intersect with these realities, sometimes reinforcing silence and other times creating pathways to resilience and justice.